Hello, Soft Tissue 1 intervention class. Today we're going to show you some accessory manipulation techniques for the soft tissue class. We're going to do the cervical paravertebral elongation as well as the subcranial inhibition techniques. So we'll do two here in this one video because they go seamlessly together. If you may notice that my patient is on the table without a pillow because we're going to be using this space for the actual manipulation. There's already some cream on the patient's skin, so we have enough to slide and work with that. So if you need to add more or less, it's fine. So for the first one, you want to press into the table and get your hands all the way down to the T4 level, okay? So which is like the area of the spine of the scapula where they kind of come together. That's typically about your T4 region. And you start with a flat hand contact, and you get yourself in a staggered position in your chair, and you lean back with a AP stance with your feet on the ground like this too, and you just simply slide up, full hand contact all the way to the occiput, and that's one stroke. Come back in, grab the next one, and do the same thing. So notice that my hands mold to the neck and form fit through. The power or the emphasis of the stroke is on these two fingers in the lamina on each side of the spine. So the power comes from here, but my whole hand makes contact, but there's an emphasis of pressure on these two fingers in that lamina space all the way up to the occiput. Okay? So we're there, and we lean back, make that full contact. Now that's one stroke, and then this falls great into the inhibitive distraction technique, which you'll fall right into it when you get to the occiput. You're simply gonna curl your fingers up, just like we do for the kneading. We get that kind of finger push-up position, like you're holding a little ball, and you hold that inferior nuchal line is where you're trying to get your fingertip contact, right on that underside of the occiput, and you hold that pressure there, okay? And this is where your patient's simply going to relax, and you have to see how much endurance you have in your fingers to hold them. Now, you can start with their palm in your head, their head in your palm, forgive me, resting on it like this. And then eventually, as time goes on, you're going to place more and more pressure as the patient tolerates it. And you'll see that now the head is off of my palm, which is hard to see with this hair, but all of the patient's weight of their head is on my fingertips, holding their head up. And we simply stay here until I feel those tissues relax, soften up, or they report no more symptoms. Great for headaches and cervicogenic issues. And that is your subcranial inhibition and paravertebral elongation of the cervical spine. Now to come out, you want to come down slowly and progress slowly out of this. You do not want to let them go quickly because there's a lot of mechanoreceptors in these small muscles up in the upper cervical spine that could actually have a rebound effect and create more symptoms.